Hello friends, I am Dr. Sanjay Agarwal, Head of the Department of Medicine and Diabetes at the Ruby Hall Clinic. Today I am going to really dwell a little bit on the facts related to weight management and why is it important for us to manage our weight. We know that obesity is the root of all problems which are related to non-communicable diseases, whether we are talking about diabetes, blood pressure, lipid abnormalities, heart problems and many others, even cancer for that matter. So weight management remains an integral part of all treatment, whether we are talking of any of these non-communicable diseases. Today I'm going to restrict my discussion on diabetes and its role and the benefit of weight loss when it comes to managing diabetes in our patients who have them. Remember that weight is basically a deposition of fat, whether it will occur under the skin, what we call as a subcutaneous fat, or whether it is deposited in the organs, whether it's the liver, pancreas or other organs. And we know that fat anywhere leads to problems. For patients with diabetes, it causes something what we call as insulin resistance, where our own insulin is unable to work to control our blood sugars, and simply loss of fat by weight management makes our own blood sugars improve because the insulin that is there works in a better manner. So weight is an integral part of our treatment, and this can be achieved through diet and of course exercise. We do find patients who are very big and they look big, but that's not really the muscle, it's all fat there. And very often what we see is patients have a lot of fat, but the muscle development is very poor. It's a condition what we call as sarcopenia. Now sarcopenia adds on to the insulin resistance and makes patients' blood glucose worse. So we need to see that we can mobilize this fat through diet and exercise, and of course do a lot of resistance training exercises to make the muscles more healthy. This is what we call as toning of the muscle, because a lot of energy is lost by muscle exercises. So when we design an exercise for an individual, we talk about endurance exercise, which can be brisk walking, jogging, swimming, cycling or any of these exercises. And you need to do resistance training exercises which will do a muscle toning up or muscle development, which will consume more energy, and that will help for fat mobilization. Now these could be basically light weights that you could do, stretch exercises, therabands, many others. And that's where our physiotherapy department in Ruby Hall is so well equipped, and we have trained people who can make you do these sort of series of exercises, which is going to benefit. The other collateral benefit of exercise is it improves the circulation to individual organs or peripheral limbs that are there. So patients who have slight compromised circulation to the limbs do feel better, because with exercise the collateral channels open up and you find that there is a better improvement of blood circulation to the peripheral organs and peripheral limbs, which sort of makes them more healthy. So friends, this is just a short video that I'm making for you, just to outline the importance of exercise and diet management. And to my mind, when we treat patients with diabetes, this is almost 50% of our treatment. So you need to emphasize that rather than be depending on medications, a lot of emphasis has to be put by an individual on how he can control his weight through diet, exercise, and I'm sure that almost 50% of the blood glucose control will happen if you just do these things very religiously. We have seen through various trials that as weight goes up, the blood sugar also goes up. And if you lose weight in a healthy manner, then you find that the blood glucoses also come down, and this benefits to reduce the dose of medication that you consume, because we know that medications have their own inherent problems. I don't want to scare you from medicines. We know that they are an essential component, but where possible we are able to step back on the doses, and that's a more healthy way of managing diabetes. We are open for in our physiotherapy department for all the exercise schedules which our trained team makes you do, and I would like you to take the advantage of the series of tests, the education, the counseling that they offer you. And we have a very nice department of diabetes at the Ruby Hall Clinic, which will ensure that you have a great control of your diabetes and you live a very healthy life afterwards. Thank you.